Hello everyone. Today I am presenting about malignant tumors of the skin. Learning objectives. At the end of this session, you should know about gross and microscopical features of basal cell carcinoma, squamous cell carcinoma, and malignant melanoma. Pre-malignant lesions of the skin. Solar keratosis, which includes actinic keratosis and senile keratosis. Bowen's disease. Xeroderma pigmentosum. Erythroplasia of Queart. Malignant conditions of the skin. Basal cell carcinoma or rodent ulcer is a locally invasive, slow growing tumor of the skin of the face in the middle aged that rarely metastasizes. Squamous cell or epidermoid cell carcinoma occurs most commonly in the skin, oral cavity, esophagus, uterine cervix, penis, and at the edge of the chronic ulcers. Malignant melanoma or melanocarcinoma is the malignant counterpart of nevus and is the most rapidly spreading malignant tumor of the skin, mucosa, and other melanin containing sites. Basal cell carcinoma. Gross features are: tumor is commonly a nodular growth with central ulceration, nodulo-ulcerative. Margins of the tumor are pearly white and rolled, while the base shows ulceration. Tumor burrows into the underlying tissue like a rodent and destroys them. Microscopic features of basal cell carcinoma. Tumor cells resemble normal basal cell layer of the skin and grow downwards from the epidermis in a variety of patterns like solid mass, nests, islands, strands, keratotic masses, and adenoid, etc. Tumor cells forming the periphery of the tumor have parallel alignment or show palisading basaloid cells. The dermis is invaded by irregular mass of basaloid cell with characteristic peripheral palisaded appearance. Tumor cells are basophilic with hyperchromatic nuclei. Stroma shrinks away from epithelial tumor nests, creating clefts which help in differentiating it from the adnexal tumors. Squamous cell carcinoma. Gross features. Tumor is either in form of nodular or ulcerative growth or fungating and polypid mass without ulceration. Margin of growth is elevated and indurated. Cut section of the growth shows grey-white endophytic as well as exophytic tumor. The skin surface on the sole of the foot shows a fungating and ulcerated growth. Squamous cell carcinoma microscopic features. There is downward as well as outward proliferation of squamous epithelium which increase number of layers which show loss of orderly maturation. Masses of tumor cells invade throughout the basement membrane into subepithelium or dermis. The dermis is invaded by downward proliferating epidermal masses of cells which show atypical features. In better differentiated tumors, the tumor cells are arranged in concentric layers or whorls and contain concentric layers of keratin material in the center of the cell walls. The tumor cells show variable degree of differentiation and anaplasia and accordingly labeled as well differentiated, moderately differentiated, and poorly differentiated. As you can see in the picture, a few horn pearls with central laminated keratin are present. Squamous cell carcinoma. Histological types: keratinizing squamous cell carcinoma, large cell non-keratinizing cell carcinoma, small cell non-keratinizing cell carcinoma, and verrucous carcinoma. Malignant melanoma. Gross features are: it may appear as flat, macular, or slightly elevated nodular lesion. The lesion exhibits variation in pigmentation, appearing in shades of black, brown, grey, blue, or the red. The borders are irregular. As you can see in the picture, there is malignant melanoma of oral cavity. In this hemimaxillectomy specimen, whitish oral mucosa shows an elevated blackish area with ulceration. Cut surface shows blackish tumor with irregular outlines. As you can see in this picture, there is elevated blackish area of ulceration, and the surrounding surface shows the whitish mucosa. Microscopic features of malignant melanoma. The tumor has marked junctional activity at the epidermodermal junction and grows horizontally as well as down into the dermis. The invading tumor cells are arranged in a variety of patterns: solid masses, sheets, islands, nests, etc. There is marked junctional activity at the dermal epidermal junction. Individual tumor cells contain large vesicular nuclei with peripherally condensed chromatin and having prominent eosinophilic nucleoli. The cytoplasm is amorphophilic. Melanin pigment is present in the cytoplasm in the form of uniform fine granules. Tumor cells resembling epithelioid cells with pleomorphic nuclei and prominent nucleoli are seen as solid masses in the dermis. Many of the tumor cells contain fine granular melanin pigment, as you can see in the picture. As you can see in the first two pictures, we can see tumor cells with abundant melanin pigment in the most areas. The tumor metastasizes in a deep inguinal lymph node. Thank you.